All right, everyone, welcome back. This is lecture 1.4 for Module 4 and RAD104. And we're talking about medical ethics and law. And we're talking about law. We just talked about intentional torts. Now we're talking about unintentional torts, and that's where we get into neglect. Now, neglect is a failure to behave at the level of care of someone with ordinary prudence, so someone who normally does something, and you, for some reason, didn't do that something. So the example I often use is normally when you take a patient on a stretcher and you bring them from one place to the next, you have both side rails up. For some reason, let's pretend you forgot to put the side rails up, and while you were wheeling that patient down the hall, they fell out of their stretcher and hit their head. So, normal behavior when someone of ordinary prudence is walking with someone or pushing a stretcher, they put the side rails up. For some reason you didn't. That's the breach or deviation from duty. And there was an injury sustained because of that. Because the side rails were left down, a person fell out and hit their head. There's the injury. And the cause as a result of that breach was me not having those side rails up. So that is considered unintentional or neglectful. Now, doing something like x-raying the wrong patient, x-raying the wrong anatomy, doing the wrong side, those are all considered unintentional torts. If a patient falls when left unattended, then that might be also considered an unintentional tort. We didn't mean for that to happen, but it happened. And so we've got a wrong, someone is injured, and someone's going to have to be held liable. Now, malpractice is usually a little more specific with regards to what happened, in that the medical professional, whether they meant it or not, for some reason deviates from the normal standard that other people would have done. So it is very similar to negligence, but it's usually specific to a certain case or a certain event. For example, again, I read about a case where an individual presented themselves to a small emergency room that was already busy. The person was fairly young. The person was complaining of chest pain, shortness of breath, and anxiety, and just didn't feel right. And the patient chalked it up to anxiety, left that patient in the waiting room for some time, only to find out that the patient was complaining even more. They finally did a CT, and there was bilateral pulmonary embolism. And so this doctor, instead of moving quickly with this person, put them back in the waiting room, had them wait in the waiting room for hours, and prevented them from getting care. So there was a delay in their diagnosis, where some other doctors in that similar circumstance might have gotten that patient into the CT scanner a little bit quicker. So that was considered malpractice. Now, 3 areas of frequent litigation for malpractice would be patient falls, positioning injuries, making a person do something that maybe their injury is preventing them from doing something, or their condition from doing, and you hurt them even more by putting them in a specific position, not checking for pregnancy, and again, any type of delay in diagnosis are all considered malpractice and often seen with radiology. So if we're looking at comparing negligence with malpractice, again, very, very similar, and usually malpractice can be a form of negligence, if I could say it that way. But medical negligence is a broad term where there's a failure to provide some type of care, attention, or supervision, or something like that, which ended up with the patient being unintendedly harmed. That's negligence. With malpractice, usually fails to act in a specific situation. They're not acting as other medical professionals would in the same situation. And that change in behavior, that deviation from the normal behavior, leads to harm. If you have any questions about negligence or malpractice, let me know and I'll see if I can help you out. There's a couple of Latin terms that you need to be aware of. And these should be layup questions in the registry. You need to put these in your head. The first one is something called res ipsa loquitur, and that just means that the thing speaks for itself, that what happened happened. So let's go back to my simple example of I left the side rails down on a stretcher when I was moving a patient. On that stretcher, the reason why they got hurt is because I left the side rails down. Normally, I would have the side rails up. For some reason, I didn't, so it's negligence on my part. And if that's not the case, then it's up to me as the radiographer. The burden of proof is on me to say why I didn't have those side rails down. Is there a reason why I didn't have the side rails down? Maybe there was. And if that's the case, it's up to me to show the court or to show whoever that it wasn't necessarily my fault. I couldn't put the side rails down because XYZ. So the thing speaks for itself. Res ipsa loquitur is one of the Latin terms that you should be aware of. The other Latin term you should be aware of is respondit superior, which means let the master answer. And that just means that when someone is suing, if I'm the radiographer being sued, they're not actually suing me. They're actually suing the hospital. The hospital is considered the master. So let the master answer. Let the hospital speak for the hospital. I'm obviously there to inform the hospital as to what happened and what I did and all of that. But the person being sued, the person liable or the entity liable is not the technologists themselves. It would be the hospital. Now, the hospital can in turn, fire me, let me go for negligence. But as far as the court is concerned, the hospital will be sued, not the individual. And that is a term called respondit superior, let the master answer. The hospital has to represent you. And it's them on the line, not necessarily the individuals involved. All right, there's some terms that are directly associated with the patient themselves. So I want to go over that with you. The first one is consent. And I think we know what consent is, that the patient has agreed to or says, yes, you can treat me, or yes, you can do something to me like a procedure or a surgery or whatnot. And there's different kinds. Verbal consent, obviously the person says that they want help or wants the intervention. Written, so normally there's somewhere it's written down and the patient signs a written form, and that could be written consent. And then there's implied consent, and that's where a person shows up into the emergency room, they're unconscious, and it is implied that that patient would want care if they were conscious. If they were awake to say, hey, help me, they would say that. So there's implied consent as well. It should be known that someone could say, yes, I want this procedure, and at the very last minute they could say, stop, I don't want to do this anymore. And then you have to adhere to that person's wishes. They can take back any consent at any time. Now, in order for a patient to give their consent, they must be of legal age, which is 18 years old, which is considered the minimum age for an adult. There are some exceptions to that. I don't know if I would necessarily worry about that, but there's exceptions for if you're 14 to 17, I believe, and you show up in the emergency room and you need emergency care, it's an emergency, like a real emergency, then you can consent, even though you're under the age of 18. Some states allow marriages to happen under the age of 18. So if you're married and you or your spouse needs attention or care, then that's an exception as well. So there are exceptions, but for the most part, in order to give consent, you have to be 18 years old. You must be of sound mind. You must give your consent freely. You're not pressured into it. There's no backdoor deals or money given. You must consent freely. And the patient must be adequately informed about the procedure to take place. So they must understand the risks and the benefits associated with the procedure, and they decide to do it on their own free will. So, all right, and I'm going to stop here because the next slide we go over something a little bit different. So if you have any questions about this information, please let me know. I hope this video helps, and I'll see you at the next one. All right, bye.